Good day, everyone. Today we'll be taking an in-depth journey through the interconnected world of urbanization and health. We'll move from understanding what urbanization is and why it matters, to tracing its historical roots, looking at its impact, good and bad, and then exploring how it shapes our health in ways you might not have considered. I'll walk you through real examples, relatable analogies, and key lessons from different parts of the world, so you can connect the theory to what's happening right now in cities and communities. 1. What is urbanization and why does it matter? Urbanization is essentially the process by which populations shift from rural to urban areas, resulting in the growth of cities. But it's not just about people moving, it's about how entire ways of life change. Think about how living in a bustling city differs from life in a quiet farming village. Your work patterns, the way you get food, the pace of life, even the sounds you wake up to, all shift. Why does it matter? Because the majority of the world's population now lives in urban areas. According to the United Nations, over 56% of people globally live in cities, and that figure is expected to grow. Urbanization shapes everything from economic opportunities to environmental pressures and public health challenges. 2. A brief history of urbanization. Urbanization isn't new, it's been with us since ancient civilizations like Mesopotamia, the Indus Valley, and ancient Egypt built cities as centers of trade, governance, and culture. However, the Industrial Revolution of the 18th and 19th centuries dramatically accelerated urban growth. People flooded into cities like London, Manchester, and New York to work in factories. In the modern era, developing countries have been experiencing their own rapid urbanization. Think of Lagos in Nigeria, Dhaka in Bangladesh, or Sao Paulo in Brazil. These cities have grown so fast that infrastructure often struggles to keep up, leading to challenges in housing, sanitation, and public services. 3. Trends and drivers of urbanization. Urbanization is driven by both push and pull factors. Pull factors include job opportunities, better healthcare, and education. Push factors include rural poverty, lack of opportunities, and environmental pressures like droughts. Current trends show that urbanization is especially rapid in Africa and Asia. For example, Nigeria's urban population grows by over 4% annually, driven by both migration and natural population increase. Another driver is globalization. As cities become economic hubs connected to international markets, they attract talent, investment, and infrastructure. 4. Impact of urbanization, housing. Housing is one of the first areas affected. In well-planned cities, urbanization can lead to modern apartments, organized suburbs, and better housing quality. But in many rapidly growing cities, housing demand outpaces supply. This leads to the growth of informal settlements, slums, where residents often face overcrowding, poor sanitation, and insecure tenure. Examples include Kibera in Nairobi and Makoko in Lagos. Housing is also linked to health. Poor ventilation, dampness, and overcrowding can contribute to respiratory diseases and spread of infections. 5. Impact of urbanization, aging. As cities develop, life expectancy often increases, leading to aging populations. This is more common in developed nations like Japan, where urban areas have a large elderly population requiring healthcare, mobility assistance, and social support. Aging in urban areas poses challenges for health systems and urban design. Cities need more age-friendly infrastructure, ramps instead of stairs, benches for rest, and healthcare centers that cater to chronic conditions. 6. Impact of urbanization, culture and migration. Cities are melting pots. Migration, both domestic and international, brings together diverse cultures, traditions, and languages. This enriches city life through food, music, festivals, and art. However, cultural diversity can also create tensions if not managed well, leading to segregation or discrimination. For example, London celebrates its multiculturalism with events like the Notting Hill Carnival, while also grappling with issues of housing segregation and integration. 7. Impact of urbanization, environment. Urbanization puts pressure on the environment in multiple ways. Increased waste generation. Higher energy consumption. Air and water pollution. Take Delhi, India, for instance. Rapid urban growth and vehicle emissions have made it one of the world's most polluted cities, with significant health impacts like asthma and cardiovascular disease. 8. Implications for future urban development. Future urban planning needs to be inclusive, sustainable, and resilient. That means designing cities where housing, transport, jobs, and green spaces are integrated. Smart cities, using data and technology to manage traffic, energy use, and waste, are part of the conversation. The goal: cities that can support large populations without compromising quality of life or destroying the environment. 9. Urban sustainability. Urban sustainability is about balancing social, economic, and environmental needs so cities can thrive long-term. Examples include expanding public transport to reduce car use, promoting renewable energy in buildings, creating green belts and parks to offset pollution. Copenhagen is often cited as a model. Its cycling infrastructure, renewable energy policies, and waste-to-energy plants show how sustainability can be woven into daily urban life. 10. Nutrition in urban contexts. Urbanization changes diets. Urban dwellers often have more access to processed foods, fast food outlets, and supermarkets than fresh farm produce. This can lead to a nutrition transition from traditional diets high in grains and vegetables to diets higher in fats, sugar, and salt. For example, rising obesity rates in urban South Africa have been linked to increased consumption of fast food and sugary drinks. 11. Physical activity. Urban living can reduce physical activity, especially when people rely on cars or public transport and have sedentary jobs. However, well-planned cities can encourage exercise through walking paths, parks, and recreational facilities. New York's High Line, an elevated park built on an old railway line, is an example of how urban spaces can promote activity. 12. Mental and emotional health. Urban life can be exciting but also stressful. Noise, congestion, and fast-paced living can contribute to anxiety and depression. Yet cities also offer better access to mental health services, social activities, and support networks. A balanced city life might involve using green spaces for relaxation, joining community activities, and maintaining social connections. 13. Personal care and body systems. Access to clean water, hygiene facilities, and healthcare in cities generally improves personal care. However, inequalities persist. In some urban slums, residents still lack safe water and adequate sanitation, increasing risk of skin infections, gastrointestinal diseases, and other health issues. 14. Growth, development, consent, and human sexuality. Urban areas tend to have more resources for sexual health education, reproductive health care, and gender equality advocacy. Consent education and safety campaigns are crucial in cities where anonymity and dense populations can also lead to higher risks of harassment or exploitation. 15. Tobacco, drugs, and alcohol. Urban areas can expose residents to more opportunities and temptations for substance use. Advertising, peer influence, and nightlife cultures can drive consumption of tobacco, alcohol, and illicit drugs. Public health campaigns like Australia's anti-smoking ads or New York City's soda tax aim to curb these risks. 16. Disease and disorders. Dense populations make disease spread faster. The COVID-19 pandemic illustrated how urban density can accelerate infection rates, but also how urban infrastructure can aid response through hospitals, testing centers, and public communication. Cities must prepare for both infectious diseases and chronic conditions like diabetes and heart disease. 17. Mental health revisited. Urban health strategies increasingly integrate mental health into primary care. Programs like Healthy Minds in Toronto bring counseling services into community centers, making support more accessible. 18. Prevention, skin, hair, nails, eyes. Prevention in urban health includes promoting skincare in polluted environments, encouraging eye checks for skin-related strain, and ensuring access to hair and nail care services to maintain hygiene. In heavily polluted cities like Beijing, public campaigns remind citizens to use protective creams and eyewear. 19. Let's wrap up. Urbanization is a powerful force shaping the 21st century. It brings opportunities for economic growth, cultural exchange, and improved healthcare, but also challenges in housing, environment, and public health. The key takeaway: urban health is everyone's responsibility, from policymakers and city planners to residents making daily choices. By blending smart planning, public health initiatives, and community engagement, we can create cities that are not only larger but also healthier, more sustainable, and more inclusive.